Dengue is now the name of terror, because the patient is admitted to the hospital every day with symptoms of the disease. For whatever reason, the mosquito repellent or control program has not seen success. The common symptoms of dengue disease are similar to those of other viral diseases. Many have taken treatment in their own initiative for so long, but this time the symptoms of dengue disease have changed. The World Health Organization, WHO, revealed some of the worst signs of dengue disease in the past 24 years. Acute abdominal pain, excessive vomiting, more than 3 times in 24 hours, body water freezing, inside the mouth, white blood is visible in the white area of the eye, feeling overwhelming fatigue or weakness. The liver is larger than 2 centimeters. In the blood test, HCT increased, platelet decrease. The immune system in our body, once infected with a virus, gains the power to act against it in the future. Against the kind of dengue that has been so long, our body has some kind of antibody, which for some reason makes it worse when there is a cross-reaction of the new dengue type with that antibody. If the body's immune system is so low, it becomes more dangerous. Caution: since elimination of mosquitoes is not possible, survival is now a viable measure. Again, the normal life is disrupted if mosquito is more conservative. Controlled use of drugs that remove mosquitoes can relieve us a bit. There is a drug called mosquito repellent, which can be applied to certain parts of the baby's clothing to keep them out. Quitting the habit of sleeping during the day, using mosquitoes and so on. Symptoms: children and the elderly are usually physically weak. Their feelings are not as common. They need to be kept separate. When normal activities are reduced. Abnormal body cold for 24 to 4 hours after the fever is gone. See severe appetite, speed of breathing, reduced urine than normal. Adults are usually busy at work so many times they do not understand whether he is really going to bed. There are many signs of this. The death rate shows how much we are depressed. So some things to keep in mind, such as whether the amount of urine decreases with fever, whether the breathing speed is increasing, those who have had heart problems have any new symptoms of heart disease. If a person who did not have heart disease had sudden symptoms of heart disease, when the body becomes colder than normal, difficulty staying up or feeling low in pressure, etc. Things to do: drink plenty of water, sorbet, and liquid foods. Native fruits like vitamin C should be consumed more often, because they increase immunity. Smoking habits should be quit, because it causes a variety of damage, including variations in blood content. If you have a fever, it is not right to start treatment yourself. It is very important to be careful about taking painkillers this season. Where to go? It is safe to seek refuge in a specialist or MBBS physician. The tests that the physician will provide for the diagnosis should go to the established diagnostics where the specialist physician reports. Because these tests are now available in many places, but it is normal to make mistakes when tested by an unmanned kit reagent. If you are not diagnosed with such a loss, then you are more likely to suffer the wrong diagnosis. During the outbreak of chikungunya disease last year, people had to suffer extreme pain due to the use of substandard kits. This time it may be so, because some bad guys are always looking for lucrative profits. Not dengue, but reports came out that dengue has a high risk of financial, human and physical harm. Public hospitals are always the best at treating dengue, because there is a chance to get any service at any time. So far there has been no news of the death of a dengue patient admitted to a government hospital. Dengue disease requires blood. In that case, the government center is ahead in terms of service. The person who gives blood must take care of a few things, such as he will refrain from donating blood for at least 7 hours if he does not have any blood clotting. No one should go to a blood donation center to get empty, especially over 4 hours is acceptable.